Thank you very much.
Thank you, Mr. President. We do appreciate your leadership on this issue and bringing everybody together. My name is Tony Aboud. I'm the Executive Director of the Vapor Technology Association. We are a national trade association which represents companies throughout the entire industry. And we are looking and are urging an urgent solution to this issue of youth vaping.
Do you have the solution?
We do and believe we have the solution.
Say what it is.
Yeah, absolutely.
Let's hear it. Go ahead. Matthew.
Mr. President, it's a pleasure and thank you for taking the time to do this. My name is Matthew Myers. I'm the president of the Campaign for Tobacco-Free Kids. I've been working on reducing death and disease from tobacco for 35 years, and I've never seen an epidemic this serious, this rapid, and this intense as caused by the flavors of e-cigarettes among our youth.
And do you think you have a solution?
I think that we do have a solution, and I think in September, the solution that you posed is an extraordinarily powerful step in the right direction.
Okay, we'll take a look at it. Good.
Mr. President, thank you for having me here. I'm Casey Crossway. I became CEO of Jewel Ads 8 weeks ago. This is a very serious issue to discuss, so thank you for hosting us to have the discussion. I'm honored to be a part of it, and I look forward to engaging with everyone in the room on solutions to the problem.
So did you know it was going to be so controversial?
Yes, sir. I knew I was stepping into a pretty intense environment, but happy to lead the company and honored to offer solutions here to this problem.
Thank you very much.
Thank you.
I'm Dr. Sally Goes. I'm a pediatrician from Fayetteville, Georgia, and I'm president-elect of the American Academy of Pediatrics, and thank you so much. The children are counting on us.
Good. Thank you very much.
Hi, I'm Christopher Butler. I'm Executive Director of Americans for Tax Reform. Thank you so much for having us. We're concerned both about the public policy implications of this for adult vapors, but also we view it as something as a prerequisite of keeping people in the Liberty Coalition that are necessary to us doing everything that we care so much about on economic, tax, and regulatory policy.
Very good. Thank you very much.
Good afternoon, Mr. President. I'm Jerry Reedy. I'm CEO of the American Cancer Society and the American Cancer Society Cancer Action Network. And I want to thank you for making this public health epidemic a national priority.
So where are you? What is your stance? It's a very important position you have. What is your stance on vaping, e-cigarettes? How are you? Have you taken a stance?
Yes, we have, and we are totally aligned and supportive with the position you took on September the 11th. We think that is a right step.
That I put forward as a concept.
Forward, correct.
Okay. Okay. Let me take a look.
Joe Grogan, Director of the Domestic Policy Council. Good afternoon, Mr. President. My name is Scott Ely. I'm the President of the American E-Liquid Manufacturing Standards Association. You know, it's a kind of a long book called AMSA. We were founded in 2012, and we open publish manufacturing standards for e-liquid products that anybody, any manufacturer in the industry may use.
And if you don't have high standards, you're going to have some very dangerous things happen. That's what's been
Absolutely,
happening,
sir.
right?
Absolutely.
Where people are using devices and other things that are not good, right?
No, that potential would certainly exist.
It's a problem. Thank you.
Mr. President, Penny Nance, CEO and President of Concerned Women for America, and we very much support what you put forward in September. We have 500,000 members, many of whom are moms, and are very concerned. And in addition, they asked me, begged me, deluged me with notes to tell you that they love you and they support you all the way. We
Thank you very
appreciate
much.
you.
It's very nice.
I have things.
Thank you. Very
Mr.
nice.
President, thank you for having me here. I'm Tim Chapman, the Executive Director of Heritage Action. We are very concerned about this issue. We want to play an active role in helping you get to the right solutions. More importantly, we are big supporters of many of the policies you've been pushing, so thank you for that.
No, thank you very much.
Mr. President, thank you for the invitation to be here. My name is Harold Wimmer. I'm the President and CEO for the American Lung Association. And on behalf of our organization, I want to thank you for your leadership in bringing this issue to the public light that it needed to be, and also for you to also help us focus this on the kids and to really work on this regarding the addiction that kids have on e-cigarettes now.
And what is your position, may I ask?
It's very similar to what you proposed on September 11th, to ban all flavored e-cigarette products.
Okay. Good, thank you.
Thank you very much, Mr. President, for having me here. I'm Mike Huff. I'm a state senator from Frederick and Carroll County. We're actually home to Camp David, so we'd love to have you there. And this is my part-time job. My other job, I'm Chief of Staff for Congressman Alex Mooney from West Virginia. So we're both big fans of yours.
Say hello.
Probably second only to my wife, who was one of your original supporters after you came down the escalators.
Thank you. Say hello. Thank you.
I will do that.
Kellyanne, go ahead.
Kellyanne Conway, Counselor to the President. Mr. President, thank you very much for not shying away and looking the other way at an emerging public health crisis, and for the courage to invite people from both sides of the issue in the cabinet room to have this conversation. Thank you, Mr. President.
Thank you, Kellyanne. Yes.
Mr. President, I'm Senator Mitt Romney. Myself and Senator Merkley have offered legislation that is very consistent with your policy from September, your discussion in September, which is to ban flavors so that we don't have kids getting hooked on nicotine products. We also insist that cartridges are tamper-proof, so kids can't add contaminants to the cartridges, but it's very consistent with your point of view.
Thank you, Nick. Well, this is a very big subject, and it's a very complex subject, probably a little bit less complex than some people think, but I'm here to listen, and I have very divergent views. Who would like to start? Maybe I'd ask Alex, just start, give us a little bit of a background on where we are, what we're doing, what we're thinking about.
Sure. Well, thank you, Mr. President. Thank you for your work and leadership on this issue. Your attention to it demonstrates your deep commitment to Americans' health, and in particular, the health and well-being of our youth. While e-cigarettes can potentially be an off-ramp for adults that are addicted to combustible tobacco, we can all agree that we can't allow them to become an on-ramp to nicotine addiction and combustible tobacco use for our kids. As the President said, we're here today to listen to you, individuals and organizations that represent many different aspects of this issue. The question of how to regulate e-cigarettes is highly complex, so it's vital to gather an array of perspectives to understand the best way to go about protecting America's youth. So thank you, Mr. President, for organizing this gathering today, and we all look forward to hearing from our guests.
Good. I do too, and I want to. How about you starting? You had a pretty interesting point of view early on. Where do you stand?
Well, I think that, you know, we clearly in Kentucky have a problem with teen smoking, but I think that having access to vaping products is not necessarily the answer. And it goes beyond just the flavors, in my opinion. We shouldn't have access for any vaping product, I think, until you're 21 years of age. The more you introduce nicotine into a kid's brain, the more it has shown that they become addicted to other substances. So the longer that we can keep nicotine out of the hands of kids, I think it's in everyone's best interest.
Well, one of the things we'll be talking about will be age, because age is a big factor, and we're going to be coming up with a number. I think we have to come up with a hard number at some point, so we'll be doing that. Let me know. So you had something very interesting to say before. Go a step further, please. Yeah.
Well, again, I also want to amplify what others have said. You know, Mr. President, it is no secret that you have great instincts. And your first instinct on solving this problem of the youth vaping epidemic, we and I think many people in this room believe is the right one. And that is ridding the market of all of these flavors, including menthol flavor and mint flavor, because it's the flavors that have hooked the kids and that kept the kids from perceiving harm in these products and the presence of nicotine. And so, you know, I'm here, we've stayed up all night. We're a grassroots group representing families all across the country, and we went through the thousands of emails and letters and social media outreach that we've gotten from families in, you know, every state that I can think of, in Florida, in Ohio, Wisconsin, New York, Texas. These are real life stories. I'm happy to leave this for you. Of families who have had their lives upended by the severe nicotine addiction that was caused by these flavored e-cigs. Kids are in pain, and we need you to help us.
People want to leave the menthol. They say get rid of flavors, but leave the menthol. I've heard that from a lot of people. No? Go ahead.
Well, what we have seen in the data is that if you leave the menthol, then they'll start using menthol. And what we've seen so far is that even when some flavors are eliminated, that they'll still keep on going to anything that's flavored. So that is not a good solution.
What do you suggest?
I'm suggesting exactly as what you suggested, that you take all flavored e-cigarettes off the market, including mint and menthol.
Well, the new JAMA data suggests that kids don't use menthol though, so.
I think there's a problem because in the cigarette category, a third of the category is menthol. And there is no question this country needs to solve the problem of youth access to vaping. I think we can do that. I think your comment about going to V21 is a step there. But I think things like no direct access to vaping products, i.e. keeping them behind the counter, I think things like that are important. But menthol, if part of the reason why we have vaping is to try and help people that are smokers migrate to a lower risk product, a third of the smokers are menthol smokers. And by eliminating that, I think that cuts off that path. But we have to really be very serious about preventing sales of vape products to any minor, and stores need to face the consequences if they do that. I mean, they should get their licenses pulled and so forth.
How many stores do you represent?
153,000, 2.5 million employees that conduct 160 million transactions a
Were you
day.
hiring stores 5 years ago because of what's going on with the internet? I mean, you're losing stores now to the internet, wouldn't you say? Would you say
Not-
you're losing stores?
No, not convenience stores.
Not convenience.
No.
That's good.
Remember,
That's a positive sign.
I think David Urban took you into a Wawa in Pennsylvania during the campaign. So those are my people, and probably more importantly, they're your people too.
They are, and they're great people. What are they saying about the vaping phenomena? What are they saying?
They're saying the same thing as they say about our sales of beer, wine, cigarettes. You know, we're in every community in the United States. We have a reputational risk in those communities, and it is super important for our members to be socially responsible retailers. So the focus we have on doing that through training programs, through reprogramming POS terminals to prohibit the sales of products to people that are underage, super important. I mean, we need to have a very serious regulations about sales to underage people.
So then, representing all of those stores, great people, what is your solution? What is their solution and your solution?
So kind of 6 points. First, as I mentioned, prohibit direct access to the product, meaning put it behind the counter, only employees have access to it. Second is restricting sales to people 21 years older and older.
So 21.
Third is restricting the number of items they can purchase per transaction. So you can't, one of the problems you have is that adult age people are buying more than they need and then reselling it, social sales to underage people. We need to restrict that by restricting the number of items they can buy in a transaction. I think we need to require either a training program for employees or require reprogramming of POS terminals. The FDA has the authority to do that under the Tobacco Control Act and has never approved a training program. If they did, they could fine and restrict and pull licenses for people who don't train.
And what about flavors?
You know, our most important thing is a level playing field, that all retailers abide by the same laws, you know?
So are you saying
we
would
think
you not
flavors are
restrict?
probably good for adult smokers. They're horrible for anyone else. But if there's a level playing field, if you decide that this is what you're going to do.
So what would you do with flavors?
If we would abide by the law, if the law decided to ban flavors, we would abide by that law.
Sure. Mr. President, your instincts on September 11th were correct, but facts and the situations change. On September 11th, you were under the impression what the CDC was saying was that vaping in general was killing people. But now we know from the CDC that their main focus of their investigation, it's not store-bought nicotine products. It's not the companies that Tony Abood represents. It was illicit THC oil cartridges sold by drug dealers. And so right now, it's important that you know, Michael Bloomberg, who is no friend to your presidency, he is funding $160 million to try to ban these flavors. And many people in this room are the recipients of those monies. So they are not here
with the position of we can come to a compromise. They have money specifically to get these products banned. And the 10,000 plus small businesses, they can't survive with just tobacco and menthol. They age restrict, they only allow adults in their store.
So what would you do?
I think we need to raise the age to 21. We need bulk sales purchase limits. We need marketing restrictions. And also, most importantly, there is in May of 2020, every single vaping product on the market has to go through what's known as a pre-market review. That's going to cost several $1 million per product. So even if we solve this crisis today, which I hope we do, in 5-6 months, we're back where we started with potentially only the largest multi-billion-dollar companies being able to survive.
Because people can't afford that.
Exactly, and all these small businesses, they're the ones that are employing people, 70,000, 80,000 direct jobs, 70,000 indirect jobs.
So what are you recommending on flavors?
On flavors, we think we need at least a wide open market in some places. So we would prefer only tobacco 21, bulk sales limits, many things advocated by NACS, but at the worst, products that haven't undergone FDA review should be able to continue to be sold in adult-only stores. But that's not the best. We want smokers to be able to access these products everywhere they can purchase a pack of Marlboros. And Senator Rand Paul, who is a doctor, just 2 weeks ago in the Senate, he said these products have likely saved hundreds of thousands of lives, and we can't forget about the adult smokers in this debate. Thank you, Mr. President.
Mr. President, thank you. You know, we have tried, it's already illegal to sell these products to people under 18, and yet we have seen the largest increase in youth use of nicotine products in the last 4 years, literally in the history of our nation. And at the same time, with the availability of the flavors, we have seen no increase whatsoever in the percentage of adults who use these products. The flavors have fueled youth use of these products, and what's particularly concerning is it led to a level of addiction that we have never seen even with cigarettes, because these products deliver more nicotine more powerfully. So what we're seeing, and others here can talk to you about it in more detail, kids becoming addicted quicker, unable to quit, suffering extraordinary withdrawal symptoms. as a
What would
result.
you do, Matthew?
I think the answer is, having worked on this issue for 35 years, I would in fact eliminate the sale of any flavors that haven't been approved by the Food and Drug Administration. We're talking about a temporary step in order to prevent the continued dramatic rise up there. FDA has the authority then to review these products, and if any of them comply, and people can demonstrate that they actually help people quit and that they don't unduly appeal to kids, then they could be marketed. What we've seen now, though, is just the opposite. We have seen an epidemic among our kids that I haven't seen in ever before. We now have more kids using nicotine products than at any time in the last 20 years. And what's more disturbing about it is that 34% of the kids who use these products use them more than 20 days a month, which means they're hooked. They can't quit. We have stories of young people who say, I started it because it was cool, and literally within days, I lost control. Kids sleep with these products because they need to wake up in the middle of the night. This is something we can do something about. FDA has the authority to review these products. The question is, what should we do in the interim with it? And because we have seen no increase in
what would you do?
I would eliminate the flavors, all of them, except for
Menthol.
tobacco flavored.
What about menthol?
Well, what we've seen is 2 years ago, Juul said they were going to make mango less accessible. Kids moved immediately to mint. Now, if we eliminate mint, what many people don't realize is, do you know what the number one ingredient in mint is? It's menthol. We already have some companies that have multiple versions of menthol, and many of them taste a lot like mint. And so, unless FDA actually constrains something very narrowly, it's one of those big Pandora's box that we can't get out of.
Yeah. Now, you're the head of Juul.
Yes, sir.
So what do you say?
Well, when I came into the job, we decided that action needed to be taken. We agreed this was a serious issue, so we have already removed our flavors from the market. Most recently, we removed mint, and for us, that was 70% of our business. So it was a big step for us, but felt it was the right thing to do with this youth data that came out and to deal with this issue. Today, we're left with a tobacco and menthol portfolio, but ultimately, we were going to defer to the FDA.
And that's regardless of age. It's just removed.
We took it out. we took out all of our flavor SKUs, including mint. We sell menthol and tobacco SKUs, but we will defer to the FDA. We said we're not going
Who
to.
makes the flavors then? I mean, you're the biggest of the group. Who makes the flavors? Different companies?
Different companies.
And they continue to make flavors?
Yes.
Mr. President, we are the second largest vapor company in the country. We represent for every 3 Juul products that are sold, 1 Enjoy is sold.
Right.
We had 1.2% youth use versus 60% youth use for Juul. It's not necessarily a flavor problem.
what do you say?
There are 2 unassailable facts. The youth problem is a huge problem, and flavors definitively contribute to it. But on the other hand, the other problem, which is macro to this situation, is that if you ban flavors, which there is some public health redeeming virtue to doing so, 100,000 Americans are going to lose their jobs. It's not disputed by anybody in public health.
They're gonna lose their
Their
jobs.
community and the vape shop community.
Actually, the number's higher, Mr. President. The number's
Did
100.
you say they're gonna lose their jobs?
They will lose their jobs, sir. They sell, I'd like to finish. They sell exclusively flavors. So the question really is, I don't think we need to argue the virtue of youth not using these products. We all agree that they shouldn't. Enjoy, Reynolds American, who represent number 2 and 3 in the country, in the absence of Juul, represent the balance of the convenience store channel electronic cigarette market, had 1.2 and 2.4% youth use respectively.
Where is Reynolds?
We believe that you can market flavors responsibly, Mr. President. 90% of our Views consumers are above the age of 25.
You're still doing flavors?
Yes, we
so
are.
Juul's not doing, and they are both doing. That's interesting. Right?
And sir, I think that the issue or the opportunity here is to make a deal. For the industry to come here and say, we've
Well, that's
recognized.
why I have you here. I mean,
We
I'd like to
recognize
see
that
we
youth
can do
use is a
something
problem.
for everybody, where everybody's happy. The one thing I see though, you watch Prohibition, you look at with the alcohol, you look at cigarettes, you look at all. If you don't give it to them, it's going to come here illegally. Okay, they're going to make it. But instead of Reynolds or Juul or legitimate companies, good companies making something that's safe, they're going to be selling stuff on a street corner that could be horrible. That's the one problem I can't seem to forget. I mean, I've seen it. You just have to look. You have to look at the history of it. And now, instead of having a flavor that's at least safe, they're going to be having a flavor that's poison. That's a big problem.
Especially we have thousands of companies, Mr. President, and there are some very large e-cigarette companies at this table. But most of the members of our trade association are small mom and pop shops. They're small manufacturers. They're small businesses that have built this industry from the ground up, not from the top down.
So what do you say?
And we say you have to implement, as you said, this is a complex problem, so you need a sophisticated plan. A flavor ban will not work, and you've articulated one critical reason why it will not work. People will just go to the black market, and that's because adults are demanding these flavors.
But doesn't that happen? Let's say you just ended your flavors, right?
Except for tobacco.
Isn't that going to be, isn't that going to be just so, illegally, that somebody's going to open up a shop in China and ship it in with flavors and you don't know what standard you're getting? Isn't that a problem?
You already see that in New York City. If you go to a bodega to buy Juul pods, you can buy 15 different versions of Juul Mango, which have been off the market
And that's
since
where the
September.
deaths are coming in. It's really not from your product, it's from product that's made
on the black
illicitly,
market.
right?
Absolutely, on the black market.
We have China counterfeit products on the market today. What we're very focused on is enforcement to get these products off the market. But yes, Mr. President, it's an
What
issue.
did you call it? China counter?
Excuse
What
me?
is it called?
Counterfeit products that we're not producing that are on the market today. It's an issue.
And how
something
bad
we're
are
very
they? How
focused
bad
on.
are they? Bad product, right?
They're
In
bad
some
products.
cases.
The issue is you just don't know.
Mr. President, we have 5.3 million kids who are addicted. It's separate from the lung disease. 5.3 million kids. 1 million kids a day are using these products repetitively with addiction. Since the flavors have been introduced, we have seen a meteoric rise in use by kids. We have seen no increase whatsoever. Before flavors were marketed so heavily, candidly, by Juul, the #1 flavor e-cigarette on the market was tobacco flavor. We're not talking about removing all e-cigarettes. What we're talking about doing is removing the flavors that have fueled the epidemic among our kids.
I understand what you're saying, Matthew. I'm saying this. If we take out flavors, won't they just be made illegally? The same flavor, but maybe unsafe?
No, the answer to that, I think, is what you'll see is last year we saw 1.5 million more kids become addicted. We can close that on-ramp. You said it correctly in September. Former Commissioner Gottlieb has said the same thing. we can close the on-ramp. As long as flavors are
The
legally
on-ramp
available,
you're going to close
we'll
is
see
the
it.
on-ramp from adult smokers to vapor. People need flavors in order to do it.
Mr.
You're
President,
asking addicts-
Most adults are not using flavors.
You're going to
Yes,
say
they are.
people that
That's
are
not
using
accurate.
flavors
That's not
today.
accurate.
You're going to ask people that are using flavors today to go back to using the flavor of the product that almost killed them.
Senator Romney,
Mr. President,
I'm the
can I
second
tell you two
largest
charts?
e-cigarette company in the country. 92% of my revenue is flavors, and I had 1.2% youth
His is
use.
the largest company, and none of his are flavors.
We're different companies. We are
I
not
understand. His
Juul.
is
We
the
are not
largest.
Juul, sir.
His is the largest.
Over 9,000 people submitted
70%
sworn.
of youth, according to the National Youth Tobacco Survey, get their vapor products from social sources, friends, family, or other people that are 18 years or older.
You have
That's right.
10,000
Only
stores.
8.4%
You have
get it from
10,000
convenience
stores selling these things. 10,000 stores. The kids are overwhelmingly being able to get these by virtue of 10,000 stores
It's only
selling
8.8
flavors.
Not the vape shops. The vape shops are
8.5%.
typically adult-only shops, Mr. President.
turns
And
out
that's,
the
hold on
most
one
recent-
second. So it's very important for you to realize this. Separate and apart from the convenience stores and the gas stations where kids typically frequent, there is a whole separate distribution chain that has grown up, which is a vape shop that is supplied by a distributor, that is supplied by a manufacturer. And this is the new vapor
And that
industry,
is the
not the
number
old
one
tobacco
outlet
industry.
where young people
And when you
purchase
that is not
different-
accurate.
What is it?
So,
The
that is not-
CDC issued a report just last week that said, yes, kids get their vapes from social sources, that's to be
86%.
expected. The number one, 16.5% of 9 to 17-year-olds get their vapes from a vape shop. It is the number one retail source.
Much
And
more
in
than
this same,
convenience.
in
That
this
is-
same study, it also said that these kids are refused only 25% of the time. If a vape shop is willing to sell a 9-year-old
That
a
suggests we
vape,
should change the
T21
rules if
is not
somebody
going to be
illegally
enough.
sells a product. It shouldn't suggest that we should limit adults from access.
We need to punish people who are selling it.
Go ahead, what?
The convenience store industry has as the lady here just said, has a much better compliance record than adult-only stores. We sell a lot of age-restricted products. It's made from, as I said earlier, beer, lottery tickets, and vape products, cigarettes. It is vitally important to our members to do age-restricted product sales properly, and that's one of the reasons why our compliance rates are much better than just adult-only
And with
stores.
flavor or without flavor?
With anything, if it's age-restricted, we take it very, very seriously. I think this whole debate over flavors is that, half of the audience here firmly believes, and I think there's some strong evidence, that flavors help adult cigarette smokers to reduce their risk. There are also a huge concern about youths being attracted to vapor because of the flavors. We have we have to double down and do really well on
Okay,
age-restricted
I got it.
products.
Why did Juul end flavors in?
President,
You're the biggest.
When the data came out and we saw the youth usage, it was a serious problem. We felt we need to act quickly and to remove the flavors in our business.
So you think flavors are dangerous?
Well,
Essentially.
When we saw the youth data, we felt the responsible thing to do as the leader in the industry was to remove the flavors, given that youth were getting access to flavors.
And yet
Ultimate-
you think we should have flavors?
Yes, sir, I do. I think that we've demonstrated through our business model, which is unique to Juul, that we can build an adult audience of smokers without creating, former smokers without creating a new audience of youth users. And it's been demonstrated through the data. Over the last 12 months, Enjoy has been the second largest electronic cigarette company in the country. The FDA has conducted 146,000 inspections of retail establishments. We've had 29 violations. By way of comparison, Juul has had 60 times more violations than us. 60 times. They sell 3 times more products than us and has had 60 times more violations.
Why is that?
It's because of the way that we have implemented self-policed policies that limit youth access. Nobody can intellectually honestly tell you that you can permanently eliminate youth access.
What would you say about that?
What we're focused on doing, Mr. President, is getting this back to a science-based argument. We're going to fully support the FDA in this process. Flavors have demonstrated playing an important role for an adult to make an important choice, which is to put down using a cigarette if they can't quit and switch to a product that has less risk, an e-vapor. We think the science argument is very important. That's what we're focused on. We think the FDA is most appropriate to determine what's appropriate for public health.
So do you think you have it right now? You're okay? You've gotten rid of flavor?
I think we made the right decision, and we're looking forward to filing our PMTA with the FDA.
Juul removed mango in September of 2018 and youth used rose. It was the #1 most popular product on the market. Flavors aren't an issue. They are attractive to
The
youth.
kids, how about the children?
Yes, sir.
We've got almost 6 million kids addicted to nicotine, and they're getting addicted to nicotine because of flavors. 66% of the kids addicted to these products are saying they didn't even know it had nicotine in it. They thought it was just a candy type product. It's the flavor that's drawing the kids in. It's a health emergency. I salute the fact that Juul has said we're taking these products off the market because we care about our kids. The kids, the adults have access. The adults have access to menthol products through Juul. They have a tobacco flavored products.
So that's why
But putting out cotton candy flavor and what is it, unicorn poop flavor. I mean, look, this is kid product. We have to put the kids first.
Sir, that is exactly why marketing has not been addressed yet, and that's why in our plan 21 and done, Mr. President, not only have we called for increasing the age to 21, that's a no-brainer. That has to be done. It has to be done because that keeps it away from the 18-year-olds.
We're going to be doing that. 21 we're going to be doing.
But on top of that, we've laid out 21 different marketing restrictions, banning advertising on television, banning advertising of any name that involve candy, banning advertising of the kind that Senator Romney is complaining about. Everybody's criticized the industry for their marketing, but nobody is talking about actually putting in marketing restrictions.
What do you think of the Senate bill?
Well, we think it's the wrong approach, frankly, and I think the better approach would be to raise the age to 21, put severe restrictions on how you market the product. Then on top of that, you have to increase penalties for retailers, because our retailers are fine with increasing penalties because they do know that they are age gating and keeping these products out of the hands of kids. So we say 3 strikes and you're out. Today, the FDA can allow you to have 7 strikes before you're actually told to stop selling tobacco products. That's unacceptable. And that's perfectly okay from our perspective. On top of that, age verification. We are in the age of technology, and that is what this is. This is a technology product that is helping people quit smoking. And unfortunately, for some people, in some cases it is. And it's extremely important, and that's why people are so devoted to this particular product. But third-party age verification is important.
Doctors.
Yes.
I'm a pediatrician, and I take care of children every day. I saw children yesterday, and this is a crisis. We have over 5 million children addicted to e-cigarettes, and these parents and these children are counting our help. I had a teenage boy in my office crying, telling me I was just dumb. I was dumb. I don't know how to get off of this. I cannot get off of it. It is a crisis. Children tell us they sleep with their Juuls under their pillows so that when they wake up in the middle of the night, they can take a vape. These children, nicotine is so addictive, we really have nothing in our arsenal to help them except for behavioral. I'm suggesting, and the nation's doctors are here, and we're all of the same message, is that we need to take all flavors off the market pending FDA investigation of that. And we're worried that if we leave one flavor on the market, even menthol, that the children will go to that because they're going to want something to help. They're going to want something. And that's why action is so desperately needed here.
How do you solve the counterfeit problem if you do that? Okay, so they're not going to, none of these guys are going to do it. They all have legit companies. How do you solve the fact that it's going to be shipped in from Mexico?
I'm looking at Secretary Azar and hoping he has the great solution for that, because I do believe the FDA is able to do some of that. But our big thing is that, and this is really where it goes back to the children, is that we have 5 million children addicted now, but what we don't want to do is have another 5 million addicted by leaving the flavors on the market, because children like flavors. We flavor medicines. Amoxicillin in liquid is a bubble gum flavor because it tastes good. And medicine is good for children, but e-cigarettes are not, so they should not have flavors.
If I may, on the counterfeit issue, we know actually that many of these kids want to quit. They need help quitting. We asked kids, what would you do if all the flavors were taken off the market, including menthol? 60%, the #1 answer was quit. We've introduced a quit vaping program. You use it on your phone. Kids they text in. Since January, with almost no promotion, 60,000 kids have signed up for it. These kids are angry. They didn't sign up for this. They thought it was all fun and flavors until.
You get addicted.
And then they're
you know.
addicted.
Mr. President, you have the opportunity. Dr. Harris.
Thank you,
Yes,
Mr. President.
please.
And the American Medical Association commends you for the stance you took, and I think you have an opportunity here to save a generation from addiction. We know that the youth are attracted to these flavored cigarettes. And to those who argue that e-cigarettes are effective smoking cessation, the U.S. Preventative Services Task Force has not found the evidence. They examined the evidence and has not found the evidence among adults that these products work for smoking cessation. And if they have the evidence, then they should take it to the FDA, where we can evaluate, the FDA can evaluate, and we can all make decisions based on science and the evidence.
But wouldn't you say it's a lesser problem than smoking cigarettes? I mean, they say that, you know, the e-cigarettes, you stop smoking and it's better. You don't think so, Sally?
No, sir. Thank you, Mr. President. No, nicotine addiction is not good. It's bad for the children's brains. It affects them
So
with their
it's a similar
attention.
thing?
It affects
Okay,
their.
how does that compare, let's say, to normal smoking of cigarettes? What you're talking
Neither
about?
one are good.
They
But
don't
the
want to
World
answer that
Academy
question
of
because
Physicians
they don't want to
95%
admit
less.
that if an
want
adult
to
smoker
answer the
switches to
We
vaping,
want
that they
to
greatly
answer-
benefit their health. The Royal College of Physicians, Public Health England, even your own former Commissioner Scott Gottlieb has stated, smokers who switch improve their health.
Sure.
That's why they have to have options.
But the difference is, the data shows
Take 5 to
that the
10
kids who are
years.
using these products are not kids who are smokers, and they're very often not kids who would have become smokers. So that the measurement of the risk for
No,
these
you're-
kids.
that's not accurate.
It is
Less than
consistent
1%
with,
becomes
it is
smokers. Less than
consistent with
1%.
all of the government
It's just not
studies.
accurate.
These aren't our figures.
Okay, Tony, go ahead.
I'm sorry, that's just not an accurate statistic. It's less than 1%. Most of the kids who have tried this product have already tried cigarettes or some other tobacco product. These are kids that have at-risk behaviors, and that is why, yes, we have
But
to
they
do
do get people off smoking.
I'm sorry, but that's a false, I'm sorry, but
Half the kids in my high school in my
I'm sorry,
state,
but that is
Utah-
a completely false
Utah's a
statement.
Mormon state. Utah's a Mormon state. Half the kids in high school are vaping. All right? They would have used these products.
But that's why we have to have a complex solution that also preserves the adult's ability to get off a cigarette.
And all the jobs.
Go ahead. Tell me about lungs. Come on. What do you think?
Well,
Yeah, then we'll do that. But
yeah.
go ahead.
Well, no, I was saying, the American Cancer Society is an evidence-based organization like all the public health groups in here.
What is your public stance on this?
Our public.
It's a new, modern age problem that 5 years ago, I guess, when did this really begin? 5?
10 years.
Yeah.
I mean, really, yeah, but really 2 years ago, go ahead, tell me what your stance is.
No, our stance is very aligned with what you suggested on September the 11th. We fully support that position to take all flavored e-cigarettes off of the market. And I tell you,
Regardless of age.
yes, absolutely.
What about
And-
flavoring over 21, no?
There's no way to do it.
There's
Mr.
no
President.
way.
Again,
There's no way to
vape
do
is
it.
not whether there is a virtue in youth using these products. It's an epidemic of youth use. Nobody disputes that in the industry. It's a matter of if we
But wouldn't
accept.
they use it a lot less if they didn't have flavor?
Youth would. 'Cause they
So
they
they
use
use it
it.
enough. Now, then you get back to the counterfeit. Still, you still.
They
you're
would,
always
then the
gonna have that
counterfeit
problem.
market would take place, and if flavors didn't exist, their category, their entire industry would disappear. Our business would be, would be
If what?
severely damaged.
Disappear of what?
If flavors disappeared. Youth use products, but
And yet the biggest company doesn't have
in
flavor.
2000, 20% of
So why
American
doesn't the
youth
biggest
smoke
company-
cigarettes. So
Okay, I
cigarettes
got
aren't
it.
flavored.
Why doesn't the biggest company have flavors?
Because they're playing a long-term goal. I think they have make an excellent product for adult smokers, but their long-term play is sit out, file applications with the FDA, let the small and medium-sized businesses go the way of the dinosaurs, and then they can come back and have 90% of the market. So
Sounds like-
all the small
sounds like
businesses
Rockefeller.
can't wait. They don't have investment capital.
Rockefeller did that.
Well, we're talking about 151,000 jobs. A economic impact analysis that we just put out this morning from John Dunham and Associates concluded that over 13,000 small businesses would close if you implement a flavor ban. And
A
151
flavor ban.
Correct. And if you would do that, they would also eliminate 151,000 jobs.
That's just
It's
not,
big,
that's
small
just,
business.
that's just not right. That's
Well,
numbers are
that's
just
the
not,
analysis.
I'm sorry,
That
that's
is
just
their
not right.
economic-
I'm sorry.
I'm an economist, so I'm not an economist.
That's terrific. I've looked at data, and the data says there are approximately 10,000 vaping shops. All right, so you got 10,000 shops, 4 employees. All right, 4 employees per. All right, 4 full-time equivalent employees per. That's 40,000 employees.
You're leaving
It's
out
not-
manufacturers and
hold on.
distributors.
It's that the convenience stores. They sell a lot of products. They're not going to go out of business because they don't have flavors.
That's-
All right.
that's right.
So it's the vaping shops.
lose
They're not all-
manufacturers and
May I
distributors,
complete? May I
Senator.
finish, please?
Yeah.
So those, they're not all going to all go out of business because they can't sell flavors. They're not all going to go out of business. Some may. That would be unfortunate, but some may. But don't recognize, if there are 50,000 employees, full-time equivalents at vaping shops, you've got 5.5 million kids. You're talking about 100 kids addicted for one employee, typically minimum wage. I put the kids first, all right? It's over 100 kids per full-time equivalent employee.
But these are the shops, and this is the sector of the industry that has grown up to compete with cigarette companies. You have a new industry that is competing for the first time for the cigarette smoker, trying to yank them off of that cigarette. And so we have to do both things. There is no reason we can't do both things in this country. But if you eliminate flavors, according to this report, because flavors make up about 85 to 90% of their sales,
Destroy the business.
they will go out of business. There is no question about that, because no small business owner could take that kind of hit to their revenue.
How does Jewel feel about that? He's saying you're going out of business. Basically, you're saying
won't go-
Jewel.
No, it's the small guys.
Why is Jewel not going out of business if he doesn't do flavors?
They're the big guys.
Investment capital, they can wait it out. They can wait a year, 2 years to go back to having the market share they have today.
So what's your game?
Like I said earlier, I think this is a science-based evidence argument that we look forward to making. We think preserving this opportunity for adult smokers who can't quit to have an option is really important work. That's the mission of our company. This youth issue, we felt, and we were a part of it, we had to address it. As a leader, we took the tough steps to change our
So
portfolio.
you really think flavors are very dangerous then, in terms of addiction and other things?
I think flavors can play a role for adults to make a transition. The issue is kids get access to the flavors. The data supported it,
So
that's
if
why we
you're
make
out of it, and if we take them out of it, who's going to take your place? Counterfeit. No, you're going to have counterfeiters, and that gets dangerous, right?
Mr. President, I think what we'll see is if that leaves, first of all, we have not seen a growth in adults using these products with the introduction of flavors. So there's a lot of myth going on here. If you look at the government's, let me finish. Let me finish. I did not interrupt you all.
Little difference,
With that, what you will have is you will have companies who produce products that have tobacco flavor, which used to be the most popular, may still be among adults, although not among kids. And then second, what we're talking about here and what your proposal was, for companies that then have data to show that they have a product, with or without a flavor, that actually promotes cessation and doesn't unduly appeal to kids, can go to the Food and Drug Administration for the review. We're not talking about a permanent ban. What we're talking about is making them develop the science, produce it to the agency that has the authority to review it, and then have a science-based decision made about what's in the public's interest. And that's what we're really talking about. And what do you do in the interim? If we do nothing in the interim, we're going to wake up 6 months from now and another 1.5 million kids are going to be addicted, and they're not going to be able to quit. And the evidence.
So let me ask you this: the concept of letting states make their own decision. We talked about that the other day. What about that? A state. We put a 21 limit on because everyone seems to agree on that, right? Do you agree on 21?
Absolutely. Yes.
So you agree. So let's say 21. We put age limit 21. What about the concept of every state decides?
I think nationwide, we need protection for our kids wherever they live, and it shouldn't be that if you live in a state that doesn't address this issue, your children are at risk. That's what worries me about this.
And then they're going to go buy it and go back.
And you know, that's why FDA has this authority. We have a governmental agency that has the authority to address the complicated questions that exist and put in place rules and make science-based decisions.
Every company in the country, including small vape shops, large companies, Juul, has to do that by May of this year anyway. And the FDA is under a statutory obligation to provide an answer within 6 months thereafter. So what we're really weighing is this near-term solution that's being proposed. And I value what Matt says, and I value what Meredith says. I have children. I wouldn't want them using these products too. But we're valuing a 6 to 10 month solution where the FDA has to make the decision by December of next year anyway, versus 100,000 jobs. It's by the way, for the record,
it's going to be a much longer term solution. Go ahead, please.
So, Mr. President, I would just like to say, I understand this is an important conversation about jobs, but I'm here because Our group represents millions of families, of moms all across this country, and dads across this country, and grandparents. You can go to any state in this country and ask people with children. This is what people are worried
So
about.
what do you like as a solution?
So I will tell you that this is a generation of children that would otherwise not have been initiated into tobacco use. And we know that because the youth use figures were at the lowest they'd ever been before Juul came on the market with their patented nicotine salt technology, with huge amounts of nicotine going to the brain so quickly. That's why the kids talk about the head rush. This addiction is severe addiction. This is enormous amounts of nicotine, so much more than in combustible cigarettes. And parents are terrified. We hear this every day from people all across the country, all walks of life, in cities, in suburbs, in the country. And they feel like they've lost their kids. Straight A students are flunking out of school. Athletes, star athletes, can't run a mile. And what I hear over and over, what we hear all the time is, I don't recognize my child. The bouts of anger, the pain, parents are in pain, and we need you.
So what is your solution?
Our solution is
your
your
solution
solution.
is just ban it, right?
No, because we
No,
are
but
not.
if you had the real solution, just ban it, right?
No, that's not correct.
What's your solution?
My solution is what you had the right instinct for at the beginning, which is the flavors have hooked the kids. So take the flavors, leave tobacco flavor for
My
adults.
original suggestion.
Your original suggestion,
Go
your
ahead.
instinct was right.
Go ahead.
Leave we're not prohibitionists. Leave tobacco flavor for adults, because in the end, it's not there yet, but if the science ultimately proves that yes, this is going to help people quit, then they should have that right. We have no interest in
You
telling
don't think it
adults
does
what
help
to
people
do.
quit?
I don't think the science is there yet. I think that we need more data.
Well, it's actually, I do want to clarify for everyone's benefit, a lot of statements have been made about e-cigarettes and those as harm reduction devices. There has been no evidence presented to the FDA to that fact. Any manufacturer who makes that claim will be enforced against. And so you may think there's that evidence. That evidence does have to, and that is exactly the process the Tobacco Control Act requires, is bringing forth that evidence in the context of the pre-market authorization. That would be part of that process.
What do you think?
Mr. President, it's a little hard to take all the virtue signaling going on around, because you got to remember the history of this. We all were excited that there was an opportunity. And by the way, I come from Appalachia. I come from blue collar world. My brother's a smoker. I mean, I understand. It is a very addictive behavior. And it was exciting at the beginning to think, oh, look, there's an opportunity for people to get off of tobacco. But at that point, we were winning when it came with kids. The people who were buying their product were aging out, right? They didn't have a generation coming up behind them until they came up with e-cigs. And then the truth is, they targeted kids. They paid influencers on social media to make it look cool, and suddenly we had a youth problem again. And by the way, many of these same people are in cahoots with the marijuana industry and the tobacco industry. So we get money from nobody.
So
we
what do you
just
like
care about
as
the
a
kids.
solution?
I like your original solution. I think we ban all flavors. I think we take it to 21 and we ban advertising. And you could say what you said. Your point earlier was correct. There's always, when you make something illegal, there's always the black market. We could say that about anything. We could say it about heroin, right? We could make it legal. We could say that about opioids, that we could just sell it to whoever wants it. There's always going to be something illegal.
Yeah.
So I don't know if that works.
Okay, thank you. Go ahead.
Mr. President, from the American Lung Association, and I certainly want to echo our public health partners, but on a day-to-day basis, the number one concern that we hear from our communities, from parents, from schools, is that how do we really address this epidemic that we're facing? So all of us are looking to you, your leadership role, in terms of really helping to create the next generation that's going to be
From
free
American
of
Lung,
addiction.
what is your recommended solution?
Is to ban all flavors,
All flavors.
including menthol.
In other words, including menthol.
mint and menthol.
That's a big statement.
Mr. President?
That's a very big statement, though, right?
Yeah,
And
yeah,
the American Cancer Society absolutely agrees with that.
I mean, it's certainly an important step, Mr. President, but it's one that you were putting out in September as, so.
These groups have 160 million reasons from Michael Bloomberg to not come to the table and compromise on anything. $160 million from Michael Bloomberg.
It's volunteer parents
Across from you.
around the country. We are parent advocates, volunteers, because parents are in pain. I sat at a table just on Monday with 13 families from the state of Massachusetts. Everyone's story was individual to them, but also the same. People who said their kids were no longer recognizable. Their kids couldn't focus in school. Their kids were having trouble breathing. Their kids were angry. This is not a small thing. This kind of nicotine addiction at these levels, people are in pain, and parents across this country, all parents, care, and we know that you care.
So you want to ban all flavors?
We want to ban all flavors,
Including menthol.
including menthol and mint, because as was said earlier, that if you get rid of just the mint, the kids will go to menthol. The kids are addicted. Only now, when kids are frightened, do they understand they're not in control. And to the point about the predatory behavior, the reason that we started our group is because our sons came home from school one day in 2018 and said there was a mixed message presentation about juuling, and that in their school, with no other adults in the room, someone who came from an outside anti-addiction group, but in the end turned out to have been a Juul representative, told the kids that juuling was not for kids, but was totally safe, and that it would receive FDA approval any moment. And both those statements were and remain untrue. And that's why a group of moms started doing their own research and understood that this was an epidemic of enormous proportion. And as you said earlier, that the kids were targeted. This is not about risk-taking kids. This affects all families, all kids. There are 5 million kids doing this. That means there are millions of families who are in pain, and that they need you to save our generation
So how
of
many children
kids.
will do it if you get rid of the
I'm sorry,
flavors?
I didn't hear that.
How many children will do it? Let's say you don't have flavors.
Okay,
So
so right
now you have 5 million. How many children will do it if you don't have
Well,
flavors?
so here's the thing, 97% of kids who are vaping are using flavored vapes. So it is, it is.
Do you agree with it?
Youth numbers are certainly indicating that kids are getting access to flavors.
Well, it's a seed, it came from the CDC.
It came from the
So it came
CDC,
from the
but it's
government, so 97%. Really what we're talking about
Will
is,
they put their own flavors in? Let's say you can't get flavors. Are they going to inject it with flavor? Will they put their own flavors in?
Our product is a single-use
Can't do it.
cap, single-use order.
That's what adults will
I think it's
do.
worth pointing out that 100% of the deaths are the result of counterfeit products.
That's a different issue.
That's a
But I think it's worth pointing out.
Yeah, it's a different issue.
But it also
Yeah.
raises the problem that you identified.
It's an important issue, though. In other words, because I've been reading about a lot of death, and the death really is from counterfeit, right? It's not from Juul, it's not from...
It's not even
Yeah,
counterfeit.
it's also using other things.
It's
Right.
cannabis products. It's not nicotine products, it's cannabis products.
That's
That
another
have been
discussion.
legalized
Although
in some
CDC
states.
has also been
Another
careful to say that they're not 100% sure that that's the only cause. There may be multiple causes out there.
Yeah.
So I think that's important. That's what the
But it
science
seems
says.
to be, it seems to be
That's
counterfeit.
all.
Juul took the most popular flavor in the world off of the market on November 13th.
What was the most popular?
Mango, Juul Mango.
Well, they're all still
November
popular.
13th,
Most
2018,
popular?
and youth use has increased. Yes, flavors are a
Flavor
condiment.
mint there that was-
Flavors taste better than tobacco.
So when Juul took it off, you had all flavors, it took it off. What's your business now compared to what it was when you had flavors?
3 times bigger.
Mr. President.
Has your business gotten bigger?
The business grew, but we recently took mint off the market, which was 70% of our business,
So your business grew even without the flavor?
It's number one flavor.
They kept mint.
Recently is last week, right?
Yes, very recently.
Recently is
Mr.
last week,
President.
Very
so we
recently.
don't really know.
Don't know yet. We
Nobody's
just
disputing that children
just took it
like,
out.
youth prefer flavors, so do adults. 93% of adults use flavors as well. That's not the point. Here's the point, Mr. President. There are 4 companies that will remain standing if you ban flavors.
Go ahead.
Juul, Enjoy, Reynolds, and Imperial Tobacco, which owns Blue. Every other small. It's not bad for my business for you to ban flavors. It centralizes an oligopoly for me and 3 other brands that exist on shelves in 153,000 convenience stores.
I'm not arguing for the bottom line of my
So
company.
why are you fighting for flavors?
Because adults, just like flavors help as a conduit for kids to use it, it's a conduit for adults to switch from tobacco, which tastes terrible, and use the vapor product. And I believe, I'm not speaking as a representative of the company or making a cessation claim, that if I was an adult smoker, or if my daughter, God forbid, was an adult smoker, I would prefer her to use a vapor product. And if that vapor product was flavored and it gave her a 7 times greater chance of making the switch from combustible cigarettes, to me, as an individual, not as a representative of my company, that is a public health virtue.
But
Nobody's
your
just.
daughter is 6. Let's,
Yeah, my daughter's 6, but it doesn't matter.
But no,
if
but
your
what
child
I'm
smoked
saying-
Marlboros, you
no.
would give
Let
your
me
child a
explain.
Juul. I guarantee
No,
it.
your
I
daughter
guarantee
is 6,
it.
and so God forbid she should ever use any tobacco product. God forbid, and I mean that sincerely. But that's not what we're talking about. We're talking about 5 million kids who are currently using these flavored
Not currently
vapes.
using. 5 million is a misrepresentation, and I'm
So
not
the
trying to show
CDC's
you a lot.
numbers are a misrepresentation.
No, 5 million is ever tried.
Last 30 days.
Ever
Last,
tried.
no, last 30 days.
No, it's not. 5 million is not.
What if it's not, if the CDC?
It's 34.4% of 27.2%. 9% of youth are using electronic cigarettes more than 20 days. More than 20
What
days.
percentage of your business is e-cigarette?
The vapors, the vaping, the vape
Oh,
shops,
the vape.
vape shops.
It's almost all
Or
flavored.
e-cigarettes,
Yeah.
nicotine e-cigarettes, not THC, not CBD,
Yeah, the
nicotine,
vape shops
nicotine delivery devices.
Sorry.
What percent of your revenue?
85.7 to 90%.
And what percent are cartridge versus open tank or non, sort of the non-USB type cartridge approach?
They have a mix, but at vape shops, it's primarily the open systems. They do sell closed systems as well.
But it's mostly the open systems and the mix and but not
I
the
don't know what the
cartridges.
I'm not sure what the mix is.
They're not made where you would home brew it.
That's
Homebrew
not,
sort
that's
of
not
mix and-
homebrew. All of you, as you know, all of the e-liquids that are being sold in vape shops have already been registered with the FDA, with their ingredients already on file with the FDA, and those ingredients haven't been able to change for the last 3 years since the deeming regulation went into
But
effect.
what percent are cartridge-based nicotine delivery devices like Enjoy or Juul?
I don't have the
of your
number
revenue?
for it. I can get that for you, but
So would they go out? Would your shops go out of business
Most
based on
certainly.
cartridge flavored cartridge products?
if you want to sell just flavored cartridge products, then you are literally cutting off the entire industry,
Well,
and
no,
the
sorry,
vape shop
no,
industry.
You just said you don't. You just said you don't know what percent of
I
vape
don't know
shops'
the-
business
It's
is
a small percent.
I
flavored
don't know the
cartridge.
exact number.
Thank you.
It is a
Small.
small
Closed
percentage.
systems
say
are
that.
very
Just say
rarely.
it's a small
Thank you. Just say it.
Closed systems are infrequently sold at vape shops.
Right.
Right.
Thank you very much, everybody. Thank you very much.
President, where is the president? Phone call revealed, Mr. President.
It's being sent over. We're going to take a very good look at it. Okay? Thank you. Thank you very much, everybody.
Any response to Fiona Hill says that the idea of Ukraine going on 16 is false. Can you respond to Maybe your initial instinct, your initial instinct, portion of the vaping, is that still your position today?
We're going to be announcing very soon. We did have an instinct, but we'll be announcing. And we're going to continue this meeting for a little while.
You know which way you're leaning, Mr. President, on this issue?
It's interesting, all
It's
the
gonna be
public
very
health people
interesting.
have the same
We'll
point
let
of
you know
view.
pretty
You're
soon.
concerned about
Yeah.
what's happening
All
with
the,
We want to take care of our kids. Got to take care of our kids. Thank you very much. everybody.